So I have just been catching up with my friend Nina Schwabi, and we went to college together. And I recently found out, Nina, that you're running for Congress. You're running for the seat abandoned by Jerry Nadler, correct? For the Manhattan's 12th district. Is that correct?
Absolutely correct.
First of all, I'm so proud of you. I cannot believe it. And I also think, oh my God, of course, this is the perfect person for this. Nina, I mean, I'm going to catch up a little bit more with you, but you have been doing, as far as I know, public health, vaccines. You lived in Geneva for a long time, delivering vaccines for the Biden administration. Give me a little bit of a précis of your career thus far.
I've worked in access to medicines basically since we graduated from college because if you want to be healthy and you want to participate, medicines are part of it and health is critical. And I think people think a lot about health as just healthcare, but health isn't just healthcare. Health is access to housing, access to nutrition, access to mental health services, being able to get to work on time without stressing out. So there's a lot that goes into health, and that's what we've been focused on, which is really a healthy life.
Absolutely. And I have to say, one of there's a memory that stays in my brain forever, and which is I was bleeding out from this thing called vaginal cuff dehiscence, and my daughter found me practically dead in our apartment. And all I could say was, don't call 911. I can't afford the ambulance. We took Uber Pool to the emergency room. Like, these are the things that happen when you live in a society that does not value healthcare. Um, One thing I wanted to ask you is I know this is hard to answer, but what was the final straw that made you say, okay, forget it. If I can't do the change here, I'm going to do it in Congress. What made you decide to run for Congress?
I think I first started really understanding how broken our system was during COVID. At the beginning of the COVID pandemic in March 2020, my father was one of the first people to get COVID. And I took care of him by myself. And we didn't have any medicines, no palliative care, no oxygen. And all he had when he died was me knowing that he wouldn't die alone. After that, I got mad because our systems had completely failed us. And I worked in Albany, or I would say I fought against Albany to get ventilators down to the city. Albany at that time had a huge stock. The governor Cuomo had a huge stock of ventilators and wouldn't send them to the city. Then keeping kids in school, fighting hard to keep kids in school, and then fighting so that older, vulnerable New Yorkers could get access to vaccines. And from there, I was tapped to run the Biden administration's $7 billion COVID vaccine program to get COVID vaccines around the world. And we delivered pretty much hundreds of millions of vaccines around the world. Fast forward a couple of years, a year ago from now, when the Trump administration comes into power, and they get rid of everything that allows us to deliver public health. They start with diversity, equity, inclusion. If you can't provide programs to vulnerable populations, you might as not do public health because that's what public health is.
Exactly.
Then they got rid of USAID. They fired 200,000 people around the world, all providing life-saving services. Uh, and
Including my son-in-law, I want to say. Yeah.
your son-in-law. That program, the end of that program, Boston University did a study recently that estimated that 750,000 people and counting have already died because of those cuts. We spoke to friends from all over the world who couldn't get access to their HIV medications, to their TB medications, to life-saving humanitarian aid. And then the government wasn't doing anything about it, and Congress wasn't doing anything about it, and the president was holding the money, and Congress was sitting there. And I thought I could sit around in my living room and complain, or I could just be the person in Congress that you call.
I am so excited for your race because I look at the other people in there. There's George Conway, right? And I adore George Conway on Twitter and his voice, but he's not a New Yorker, right? You're a New Yorker running for a New York seat. I see JFK's grandson is running, not a lot of experience, excellent on social media. And one of the things I actually loved about your campaign so far is you tap into the fact that you're not good at social media. And in fact, when you say that you're not good at social media, actually, I think this is a brilliant use of social media. One of the ones I saw recently was, I don't know what to do with this hair. I'm a lesbian. And you just sort of like lay it all out of who you are. And that is like tapping into the Mamdani thing, right? It is why he won. He was so authentic, and you too are incredibly authentic. So I don't want you to think that you're bad at social media. You're actually secretly brilliant at it
He
because
has
you
a
are.
he has a cuter smile than me. He has a very cute smile.
Yeah, but well, you have a very cute smile too.
Thank you, Deb.
Tell me a little bit about your personal life because all the times, we elect officials, we also want to know what their lives are like. So tell me a little bit about your personal life.
Yeah, I'm a sixth generation New Yorker, which I didn't know until I did this. I thought I was a fifth generation New Yorker, and I got this older cousin who said, "No, you're a sixth generation New Yorker." Abraham Price in the 1840s lived in the 40s in Manhattan. I was like,
Where did
okay,
they come from? Do you know where your family came from?
they came from Germany.
Germany.
They're Jews, and they all came from Germany, but at different times. My most recent was my grandmother. She actually came from Russia,
Got
but
it.
the rest of them all came from Germany. But the first one we've dated back to 1848. Uh,
Wow.
yeah, I'm a lesbian. I'm a mom. I have two beautiful boys who are grown men. And they grew up here, and we're all New Yorkers. They grew up. We're gave birth to them at Lenox Hill Hospital,
Nice. And where are
and
they now? Where are they living now?
one just graduated from college, and the other one is still in college.
Nice. And what do
And
they
it's
think about
like,
your?
like all children just graduated from college, they live with their parents.
Yes, no, of course. Yes, obviously. But what do they think about you running for Congress?
They're super excited. They're sick of the status quo, and they're super pumped. And they've been really helpful and incredibly supportive and enthusiastic.
Are they
And
going to work on your campaign?
they're gonna get out there on the street with
Yeah.
clipboards like all my friends. But yeah, they're very excited about. They're sick of politics as it stands.
Well, that generation in particular grew up, there were little young kids during Obama, and then suddenly Trump comes into office, right? And then they lived through COVID, and now they're living through Trump 2.0. So, I have a 19-year-old, and that generation has had a very, very difficult time, and they're very cynical because of it. And at the same time, they're cynical, they're also incredibly hopeful that something can change. And I actually see you as, I mean, when I heard about your decision to run for Congress, I just thought, oh, that makes so much sense. And please, please, I can't even vote for you because I'm living in Brooklyn. But like, how great would it be to be there with Jim, our other classmate, Jim Himes?
Yeah, I'm looking forward to that part. I'm looking forward to working with him and others.
Have you spoken to him at all about what it's like there?
I've spoken to Jim and a couple of other people about what it's like there, and I think there is a hunger for grown-ups in the room
Yeah.
and not to stop the screaming and to stop the hand waving and just get on with business and really focus on business. Um, yeah.
Let's talk about COVID for a minute, because I know that here in New York City, we had 45,000 deaths. 45,000 deaths in New York City, including your father. I'm sorry, I didn't realize that. And the people that were getting the vaccines were rich and in wealthy zip codes. How do we create more parity around these issues of access?
But we have to set up the systems in advance, and that's what we're not doing right now. We have to make sure that everybody in New York City has access to primary health care. And one of the reasons why COVID was so deadly for us and for so many Americans is we have a lot of other conditions that make us more vulnerable to infectious diseases. So that's something we can help right away. And one of the things that we didn't do during COVID that we could easily have done was use mobile services. We have mobile libraries. That works
Mhm.
great. We have mobile blood pressure screenings all over the city. So expanding those services that get care to people where they need it is a no-brainer for helping us do better next time.
I have to say, so I got COVID on March 18th, 2020, and I was sick as a dog. I had my oxygen saturation went down to 92 at one point. I was just like struggling to breathe. And I called my primary care physician and I said, "What do I do? Should I come to the hospital?" He said, "Don't. Don't come to the hospital. You will die here." It will be, you will have be overrun, overrun by virus here. The best thing you can do is be at home. And I said, well, how do I survive here at home? And he sent me a nebulizer. Now I had access to an excellent, doctor, but really what we needed is somebody running around to houses with oxygen tanks. I needed oxygen at that moment. I could not breathe. So this idea of a mobile service, just like helping New Yorkers out or helping Americans out, I love that idea.
And with viruses too, when the next pandemic comes, it will pretty clearly be respiratory. And so working on oxygen and access to oxygen, we ran out of oxygen, as you know, in New York
Yeah.
City. We actually ran out of oxygen, which shouldn't happen.
Right. And we also ran, I mean, we didn't have PPEs, we didn't have masks. I remember we were all sewing masks at home, out of old rags that we had. Anyway, tell me a little bit more about your partner's view, your wife's view of your running for Congress. Would this mean if you win that you would have to move to New York or, I mean, to DC, or what would happen?
Well, I'm in a domestic. I was in a domestic partnership, and we co-parent. We
Got
no
it.
longer live together.
Got it.
But
Okay.
he's also very enthusiastic.
Yes.
Probably excited to get me further away to Washington. But yeah, she's been very supportive.
That's wonderful. I grew up in the DC area, and I will say you do not want to be there in the summer. It's a swamp. Hot, it's so hot and humid, but whatever. If you're there in Congress looking out for our best interests, I would be so, so glad.
I was recently in DC visiting some of your and my close friends, and the mood there is so depressed. I mean, I think with the layoffs at the Washington Post, which again affected some of our friends, and the renaming of the Kennedy Center, and all that's and the destruction of the White House, all that's happening there. It's and more importantly, the pervasiveness of the National Guard makes it a very different place. So I'm hoping we can change that.
So many people. I know Joe Men, a friend of ours, lost his job at the Washington Post. I know dozens of people who lost their jobs at USAID again, including my son-in-law. We have our friend Gawain, who's worked in international development forever and is just looking at this at like, what is going on? I, it's almost, I almost can't believe we're living in this timeline, right? I almost can't believe when I look at the news, what's happening and why we're not all screaming in the streets. I mean, I know a lot of us have been screaming in the streets. Like, this is what we were warned about what would you have done in Germany? Well, now we have a way to find out because it was the average Germans who were instigating all this. And now it's like the average American who's just throwing up their hands saying there's nothing we can do. What can we do? What can we do?
I think that it's they're playing a great game of whack-a-mole with us, and every moment there's a new urgent thing, and we try to address it without stepping back and addressing the big issue. And the big issue is that Congress is not doing its job, and they're letting the president run around them. Congress has the power of the purse. It's their decision where money gets spent and how it gets spent. They're allocating or appropriating that money, and it's not being spent. And I can give you examples of hundreds of programs, from housing programs here in New York City to international HIV programs like PEPFAR, where the money has been appropriated by Congress and the president's just said, "Hey, I don't feel like spending it." And that's a no-go. That's no deal.
So I mean, I'm throwing up my hands right here in, what is to be done? How would you, if you got in there? So the election is November 3rd, 2026. Is that correct?
Yeah, the big deal is primary because it's a Democratic seat. So the big deal is the primary, which happens in June, at the end of June.
Okay, so the big deal is the primary that happens at the end of June. That's when either you or Conway or JFK's grandson are chosen. What's his name? Schlossberg? Yeah. Who do you think are your biggest opponents right now? Like when you're looking at poll numbers, what are you looking at right now?
Well, they don't do the polling until after the candidates have. So the next part of the process is the signature period where everybody gets on the ballot. And there are 10 candidates on the ballot. I think the biggest problem is that, again, the Democratic machine wants to choose the candidate ahead of everybody else. I mean, we had Nancy Pelosi yesterday endorse a candidate. That's not a fair process. She didn't meet all the candidates and
Right.
say, "Oh, I think this one is better than the other." And that's the way the machine works. We also have people in the process, career politicians, state assemblymen, who are being paid to do a job while they're also campaigning. So there's a lot that's murky. So there's a lot that's murky in this process. But because we have so many candidates, there should be people to choose from, and I think that's exciting. People will actually this time. I mean, in our last two presidential elections, the Democratic machine chose for us, and look how that worked out.
Right, right. Well,
Right.
how are we? I'm a Democrat. I'm a proud Democrat. How are we as Democrats to help make this machine a better machine for everyone?
I think we have to call out bad behavior when we see it. And I'll give you an example. Most of the newspaper coverage has been about the guys. And there are women in the race, but the New York Times has run articles on three or four of the guys in the race and none of the women. And that's just bad behavior. City and state did the same. When coverage happens of these elections, they cover the guys and not the women. So that's one thing I think we can call out.
Yeah,
The other thing is I think we can really, there are statements about each of these candidates and we can learn about them all and decide who we want to vote for, go to the forums, go to the debates. And I know that's a lot to ask, but these are the people that decide whether or not we go to war. These are the people that decide whether or not we get polio vaccines.
right.
Just last week, the government basically said it was going to make polio vaccine optional.
I mean, I read that. I just I
100 years ago, 2,000 people in New York City died of polio, and they want to make it optional. So it's not so. So I think people have to look at that. And we also have to rethink what kind of people we want. If we want the same type of Democratic Party, then we should go ahead and elect these same type of kind of blue suits. But if
right.
we don't, then we need to elect new and different leadership to go to Congress. And that's me.
Yeah.
I'm not a career politician. I wasn't class president in school. Well, a little bit.
Yeah.
I didn't spend my life. I've led a life. I've been a leader, worked for change, and that's the kind of people we need.
Well,
If
immediately when I saw that you were running, I thought, yes, this is exactly who we need in Congress right now. We need people like you who've had careers, who've had lives, who've raised kids, who know what the issues are, who know what the cost of childcare is, by the way, right? You have raised children while working as a scientist. That's not easy.
yeah, yeah, that's exactly right. That's exactly right. I was surprised to learn that when I am elected, I will be the only Democratic public health PhD in Congress.
That
And
seems
they,
insane to me.
they decide how we get health care, how we get child care. They decide, they allocate money for all of these basic human services, and yet they don't have expertise in it. You asked a little bit about, I think we need more experts in Congress. We
Yeah.
need more experts in Congress who can look other Congress people in the face with data and evidence and explain, as opposed to talking points and sound bites.
If you were elected, what would be the first thing you would do once you're in Congress? What would be the first thing you would want to do once you're in Congress?
The very first thing we need to do is restore the CDC.
Yeah.
There is something called a level 5 lab in the CDC. That's where they keep all the really scary pathogens
Yeah.
like smallpox. That is not staffed right now. They fired all the staff in the level 5 lab. So
What?
they fired the measles department. They fired the tuberculosis department. So I think we really need to get on that. And for me, I mean, I'm going to wear a shirt on day one, which says Impeach RFK Jr.
Yeah, absolutely.
That
Yeah.
guy just has to go. And it can't wait. He's killing people right now. That can't wait. So I'm going to wear a t-shirt that says Impeach RFK Jr. And I'm going to try to get staff back in that scary lab at CDC in Atlanta.
I love that idea. I love that idea. All right, before we end, is there anything I haven't asked you that you wish I would have asked you?
Uh, no, that was a great. I would like you to just, I mean, you were on the tank when the Soviet Union fell.
Wait, I can show you. I actually have that photo. Right, it's right up there.
You were on the tank when the Soviet Union fell. And
Yeah.
you
Yeah.
saw what we're headed towards.
I absolutely feel, especially the cold weather right now, too, by the way, I absolutely feel in many, many ways that we are living in that kind of bizarre reality that when for example, when the Soviet coup happened, they put Swan Lake on the TV because, they didn't want to show the news. And I feel that way with CBS becoming just completely partisan to Trump, with a lot of news organizations being destroyed from within by billionaires, Washington Post being an example of that. We are being systematically brought to what we fought against our whole lives growing up, which is we thought the Soviet Union was the biggest threat we have. Now we are the Soviet Union. We are.
Yeah, and I think this is a seat that is safe. This seat will go to a Democrat.
Right.
Why not choose a Democrat that we want,
Yeah,
who represents
exactly.
the values that we want? Because it will be a Democrat.
Well, thank you, Nina, so much. Stay on, please, while I stop the recording, but it's so good to see you. I can't wait for you to win. I believe in you.